Today we're talking about gastritis, which is basically a fancy term for inflammation in the stomach lining. Now, if you've ever had an endoscopy done, meaning they do a scope down into the stomach lining, oftentimes they're going to do a biopsy, check and make sure you don't have an infection called H. pylori. They're going to make sure that there's no ulcers going on in there, and they're going to check for changes to our cell structure to make sure we're not entering into a precancerous state. So if all those things come back normal and healthy, oftentimes the diagnosis that gets put on the report is gastritis, which again, all it means is that there's some inflammation in the stomach lining. Now I want you to think about this the same way you think about a sprained ankle. All a sprained ankle is, when we see that swelling and the redness, is inflammation in that area, telling your body, hey, there's something wrong here, please help me, I need some time to heal. So if you had a sprained ankle, you're going to put some ice on it, get that swelling down, soothe it. You're going to stay off of it. You're not going to keep re-injuring it. We're going to do the exact same thing in the stomach lining if you have a diagnosis of gastritis. First, we're going to stay off of it, right? So we're going to stop putting inflammatory and irritating foods into the stomach lining. This is short term. This does not mean you're never ever going to be able to eat chili again in your entire life. This just means for the time it takes for the stomach lining inflammation to come down, we are going to stop putting in inflammatory foods. And then the second thing, it's like icing the ankle. We're going to try and reduce the inflammation in the area. This might mean one of a couple of things. We might put you on some anti-inflammatories. We may also put you on some herbs and supplements to coat and soothe the inflammation right in the stomach lining. Those are wonderful. And the third thing we might address is the digestive enzymes and the gastric juices that are happening in that stomach environment, so that we can sort of help to manage and mitigate the some of the other reasons that we might be having inflammation in the first place. So again, think of gastritis, inflammation in the stomach lining, as a relatively short-term condition that we should be able to treat just like a sprained ankle, where we're making sure we're removing the inflammatory foods from the diet, we're bringing down the inflammation in the stomach lining, we're allowing it to heal, and then we're gently taking you off of those herbs and supplements and bringing back some of those inflammatory foods. And what you should have long term is a remission of those inflammatory stomach pain type symptoms.